preparing for the stream.
Yep.
And then I got to go record. I made that mistake one time where I didn't record, which was unfortunate. Okay. Well, it's right at 7:01, and I think I'll get started. My name is Jamal Bynum. I'm the chair of the Moore Board of Directors, and this is one of a series of events that we're providing to the community. We call it one of our events that help bring more racial harmony and talk about some of those issues related to reconciliation. This has also been funded by Humanities Nebraska, who gave us a small grant to help us bring a number of community events to talk about race issues and class issues, somewhat equity issues in this contentious time. Moore is a nonprofit that started roughly about 10 years ago under a different name of Policy Research and Innovation. And about a year or so ago, we changed our name to Moore, which means Movement in Omaha for Race Equity. And we're focusing primarily on Omaha, but also people have joined us from other parts of the country, as well as other parts of Nebraska. We're one of the very few organizations that have as mission states to deal with anti-racism and race equity. And from our experience in working with many groups and doing many workshops and so on, that we don't have enough individuals or organizations that confront and talk about racism in a very healthy manner, or even race equity, and deal with some of the issues that confront us. The other thing that we share is that one of the things that we see our role as more is being a facilitator. We've had many opportunities where we've done workshops, events, and we know that oftentimes facilitation is not an easy task, and people do not always get credit for that. But we know that in our divided community, we don't have enough opportunities where people can get together and have healthy conversations and talk about some of those contentious issues that have divided us. In recent months, we've talked about critical race theories and other issues and brought some of those presentations to the table. We do have a webpage that you can go to, which is moreomaha.org, to see some of our past videos. And this event today, we will also post on our video, on our webpage rather, so that people can watch it at a later date. This event is also being run through Facebook Live. So there are some people who are grassroots or folks who may not be able to access our Zoom apparatuses, but they can also see us through Facebook Live. And as I said earlier, we will record this event to get more people involved in it. So without much further ado, I want to just introduce our presenter today. I've known Ryan for a few years. I got to know him better when we all went out to Georgetown and worked on a capstone program, and we're still active working on dealing with truancy and attendance in the Omaha Public Schools. As some of you may be aware of, that truancy, particularly during this COVID-19 period, is very dismal for many students of color. And we also find that many kids, young people who are low income, are not regularly attending school. And one of our concerns is, how do we address that issue and look at the data and make sure that we have some honest conversations instead of some defensiveness that is oftentimes projected when we raise these issues. I'm just want to provide just a brief overview of Dr. Spohn. Number one, I met him a while back, and he had an opportunity to do a presentation, which I was very impressed with, at First United Methodist Church a couple of years ago, where he talked about his humble beginnings in Kansas, in a rural community, and as he's transformed in terms of his life, in terms of going to graduate school, as well as getting his PhD, as well as working in this criminal justice, juvenile justice field. It was very impressive. The other thing at the First United Methodist Church that he shared with the participants, and we had a great turnout that night, is how important it is to look at people from a different perspective, and oftentimes don't judge the book by its cover. And so Dr. Spohn has been very much involved in research. He has a number of publications. I've read some of them have not. And the one that I was most impressed with was a longitudinal type study that he did. Not with longitudinal, but it was a study in Kansas about RED, or racial ethnic disparities, with young people. And one of the highlights from that study for me was that oftentimes for many youth of color, particularly African Americans, we perceive them as much older than they are. And sometimes the people in the juvenile justice and the criminal justice system treats them as if they're much older than what they are. And we have to remember that in the juvenile justice system, it's about rehabilitation and not punishment in the same sense that we deal with adults. Ryan has a number of studies in various places and so on, and he may allude to that. He also did a presentation of probably about a month or so ago with the 360, the Empowerment Network. Obviously, they didn't give him enough time to go through his presentation, and we may not have enough time tonight. But what I would like to do is turn it over to Dr. Spohn, let him provide a little bit more on himself. And then he's going to kind of share his PowerPoints. And we're going to ask people, number one, just a few ground rules. One, we're going to hold our questions to after he does his formal presentation. I think it's within 30 minutes. And then we're going to open it up for people to raise questions, comments. And the thing that is probably the most important here, folks, is data. We're talking about data, how do you interpret it, how you talk about it. And one of the dysfunctional things that I've noticed is that sometimes people will produce data and they won't have any explanations. You've done all this work, but what is your analysis at your point, at your silo point? So one of the things we hope from this conversation is that we will get more organizations, silos, individuals, academicians involved in talking about racialized data and so on. Last point, Omaha is 33% people of color. You would never know that in the way we live, and the way we operate, and the way we operate in public and private institutions. So with that, I'm going to stop and let Dr. Spohn go from there. There you are.
All right, thank you, Jamal, for that introduction. I am Dr. Ryan Spohn. I serve as director of the Nebraska Center for Justice Research. We're one of two research centers that are affiliated with the School of Criminology and Criminal Justice at UNO. That school has been a nationally ranked program for a lot of years. I'm very excited to be a part of that program. Have lived in the Midwest pretty much all my life, and as long as I've been a criminologist, I'd always heard about UNO and the good things that they were doing. So hopefully I'm contributing to that. I grew up a Kansas wheat farmer, kind of in the middle of nowhere in central Kansas. Went to Kansas State, got my master's degree at Texas A&M, and got my PhD at Iowa. So between the University of Iowa and Kansas State University, pretty much all the Husker fans probably have a reason not to like me, but I get along with a lot of them, so that's good. I should probably say that the things I'm going to talk about tonight are my own opinions. They don't represent the official opinions of UNO. Keep myself out of trouble there. But I think my research has been in juvenile justice, the child welfare system. I did work on the Lincoln campus at UNL for 2 years in the child welfare system. They had a big contract with the Federal Children's Bureau, so that was a real turning point in my life of learning a whole new system, but learning how the federal system works and how do you work with the feds and federal grants and things of that nature. I've been here at UNO for 10 years and been in the current position here for about 8 years at the Nebraska Center for Justice Research. Now we're doing a lot of work with the Department of Corrections. They've had staffing issues, which hopefully increases in pay. I know there was another article just today, I believe, or maybe yesterday, about improvements that are happening with the big boost in pay that they were able to give some of the correctional officers. We also do a lot of work in reentry. That's probably our biggest area of focus right now as a research center. We have a project with Douglas County Corrections, which is the jail here in Omaha. We do a large evaluation project with the Department of Corrections known as the Vocational and Life Skills Program, which are about 9 nonprofits and community colleges and colleges here across the state of Nebraska. And we work on a couple of grants with the Bureau of Justice Assistance in reentry. One is the Second Chance Act grant in Iowa in the Quad Cities over on the Missouri River on the Mississippi River rather than our Missouri River. And the other one is here with the Department of Parole with Nebraska. And that being said, I'll just say that April is Second Chance Act month, and there's a lot of events for people that are interested in second chances, reentry, giving people what sometimes we call first chances, because a lot of people head into prison maybe never really had a first chance, and we can talk about that later tonight. But you can Google that and see there's lots of events going on the whole month of April on Second Chance, for Second Chance month, and I'll be on one of those presentations that's focused on data. I think that's all I have for an introduction. If we're ready to start the presentation, I will do that if I can get the screen share to work, and it shouldn't take 30 minutes, hopefully maybe about 15 minutes. Jamal, can you give me a thumbs up if you can see my screen? Okay, I'll get the slideshow going. Okay, so I've done a talk similar to this in a couple of venues now, and some of you may have even seen it, but I was approached to provide a little bit of insight on a report that is not my report. It's a report that was put together by the Sentencing Project and their initiative for research and advocacy for reform. And the author of that report is Ashley Nellis, who is a senior research analyst for the Sentencing Project. And it's called The Color of Justice, Racial Ethnic Disparities in State Prisons. And the focus of this report was to look at rates of incarceration for whites, African Americans, and Latino individuals, and compare their representation in each state and then their representation in state prison systems. So pretty simple and straightforward. What is the racial breakdown in the state? What is the racial breakdown in the prison system? And the focus for that, they believe that truly meaningful reforms to the criminal justice system cannot be accomplished without acknowledging the racist underpinnings. And that sounds like some fairly strong language, but the way that I look at it, I always say that you can't really do justice-related things and ignore race and ethnicity. It's just impossible. And they argue that true progress towards a racially just system requires an understanding and variations across racial and ethnic inequities across states, the different policies that those states have, and the different practices that those states have that could be driving those inequities. So I pulled out data. When I originally put this together, people were interested in both Iowa and Nebraska. I don't know if we have any Iowa people, but it at least makes for an interesting comparison. And these are numbers straight from that Sentencing Project report. So on the left, I have imprisonment rates per 100,000 people. And so we know that whites are the majority of the population in Nebraska, but we can standardize that per 100,000 people. And you see really strong differences between the rates for whites, 195 in Nebraska, and for blacks, 1,733. And for Latinx, we see a larger ratio, not near as bad as for African Americans. In Iowa, these ratios are just as bad, and the number is a little bit higher, 225 for whites, 2,084 for blacks. And in Nebraska, 1 in every 58 blacks is in prison, and that scores 10th in the United States. In Iowa, we see an even worse number, 1 in every 48, and that's 6th in the United States. And I have the list there. It's a little bit small, but hopefully you can read it. It shows the top 10 states. And, quite frankly, if you would have asked me to guess, and, I do criminology for a living, I would have said that, it's probably the Deep South, right? When we think of issues with race, I start with the Deep South. I know that's not the only location where we have these problems, but I never would have expected that both Iowa and Nebraska would be in the top 10. And for the ratio, that incarceration ratio, which is the ratio of the two numbers over on the left, you see that for Iowa, the ratio of incarceration of blacks to whites standardized per 100,000, that ratio is 9.3 for Iowa and 8.9 for Nebraska. And, to me, those numbers are just astounding. You can think about a 5%, 10% difference is bad, but we're talking about 10 times worse, almost 9 times worse. So those are the numbers that really, I think brought this to the attention of people here in Omaha, and why they came to me and asked if I could talk about it. So this is just also directly out of that report. So again, this is from the Sentencing Project. And this just shows, and I know the numbers there are kind of small, but in figure 2, we see the black-white incarceration ratios. Darker is worse. So we see that Wisconsin and New Jersey are the two darkest states, but Nebraska and Iowa are right there with their 8 to 9 times ratio for blacks to whites, and for Latinos, that's the map on the right. Not as bad, but we still see that Nebraska is the second darkest color there. The worst states are New York, Massachusetts, over in the Northeast area. So potential causes, and these are things that, you know, I thought about here in Nebraska. These are also things that they talk about in this report. And it's never just one, right? So the 2 points of data are, what is the representation by race across the state, and what do the incarceration rates look like? Well, if we think about the criminal justice kind of funnel, we have law enforcement, we have pretrial holding in jails, we have the plea bargain process or the jury trial process, we have sentencing, we have juries, we have judges, we have the different sentencing systems that states have. So again, this isn't just individual decisions, this is also policy decisions and how those policies can impact different groups. And so we have to think about all of those actors and all of those policies and how they build upon each other to result in these racial disparities and ethnic disparities. I also talk about media portrayals of criminals of color. And so historically, you turn on local news and you're more often, a lot of research indicates that you're much more likely to see people of color represented as criminals rather than white people, more so than their participation in crime. Disparities in pretrial detention. So are you able to make bond and be at home before your trial, or are you sitting in jail? And one of the main differences here is, do you show up in trial in an orange jumpsuit, or do you show up in trial you know, in a suit and tie, or in dress that looks less incriminating? The ability to afford a private attorney versus a public defender, that makes a difference. And then finally, criminal histories, so that we have a lot of things called risk assessments that are used throughout a number of different processes of the criminal justice system. And one of a primary determinant of criminal risk is, what is your criminal record? And if our criminal histories have any bias in them whatsoever, then future decisions that are driven by those risk assessments will be influenced by past activities and past records that may have included bias as well. So report recommendations. So they had 3 recommendations, and when I first put this together, I was asked to talk about my opinions of these 3 recommendations. So the first one is eliminate mandatory sentences for all crimes. And as I showed, as I indicated, Nebraska and Iowa are both in the top 10 in disparities for incarceration. Both Nebraska and Iowa have mandatory sentences of some sort. And laws here in Nebraska, or legislative bills, have been introduced into the unicameral for many years, usually by Ernie Chambers, trying to repeal those mandatory sentences. And I know there's a bill this year that also calls to repeal or at least adjust those mandatory sentences. Another recommendation, the second recommendation from that report, is require prospective and retrospective or retroactive racial impact statements for all criminal statutes. And Iowa has prospective racial impact statements, and Nebraska, we currently have a bill under consideration. I do not believe it has moved forward in the legislative process. But what this means, so prospective racial impact statements means before any bill that would enter the criminal statutes for a state can be moved forward, there has to be a study to show what, if anything, would be the racial impact of this bill on our justice system, corrections, juvenile justice, whatever the target of the bill is. So essentially, we have to have research to show that whatever racial disparities exist, this bill isn't going to make things worse. As I said, Iowa has that in some capacity. Nebraska does not. Retroactive racial impact statements, I don't know of a state that has these, but that means you would go back and look at all of your existing statutes and see how those might impact criminal disparity or racial disparities in criminal law. And obviously our criminal statutes are enormous. That would be a major undertaking. I'd say that's very unlikely to happen, but you do see groups like the ACLU, others, that will pick out particular existing laws and show what the retroactive impact statement is. So we do see that in a limited sense. And then finally, decriminalize low-level drug offenses. And I think that pretty much makes sense. Now here in Nebraska, we do have simple marijuana possession is decriminalized. It's basically you get issued a citation. If it's a larger amount or sales, then it is criminalized. But in a major study, so in looking at prison overcrowding, prison understaffing, and the possibility of a new $270 million prison being on the table here in Nebraska, a group was brought in, the Criminal Justice Institute, to look at everything that pretty much happened since justice reinvestment in 2014, when we had the Council of State Governments come in and do a justice reinvestment study. And CJI released those reports back December, January, towards the beginning of this legislative session. And they indicated that drug possession is still the #1 intake offense in Nebraska, which I found to be kind of astounding. And so that, I think that indicates that Nebraska has not done a fantastic job in decriminalizing low-level drug offenses, and they are still having a large impact on our prison systems. And so I added a couple slides here. Now, this data comes from the Nebraska Minorities Disparity Facts Chart Book from the Office of Health Disparities and Health Equity, which is part of DHHS. I had to look that up. So if we say, well, maybe minorities are just more criminal, they're committing more crimes, and they should be in prison more. And that's something that can be studied. But I think we need to look at, what are the life chances? What are the situations? What's the environment? What's the context in which our young African Americans, our young ethnic minorities are growing up in Nebraska compared to whites? And these are just some numbers here. So a lot of this comes from the US Census. So poverty rate, Blacks 28.6%, whites 10.3%. Home ownership, 30% for Blacks, almost 70% for whites. Unemployment rates, 8.7% compared to 3.3%. Now, with everything going on recently, those unemployment rates have been moving around pretty quickly. That might be a little bit out of date, but I think the ratios are still probably fairly similar. Median household income. So if you take everybody who's making money in a household, what is the median? So that's the 50, that's not the mean, that's the 50% point, where 50% of all households are under that amount and 50% are over that amount. And we see there's almost a 2-to-1 ratio, Black to white. College education, 31% whites, 20% Blacks. Health, so no personal physician, 29% of Blacks, 17% of whites. No healthcare to speak of, we see about a 3-to-1 ratio there. Infant mortality, we see almost a 2-to-1 ratio. Inadequate prenatal care. So lots of times I say, let's not look at adults in prison, let's look at our youth, let's look at our young people, let's see what their circumstances are and what we may be able to impact. Well, you can't get much earlier than prenatal care. And we see more than a 2-to-1 ratio here. Over 1/4 of all Black youth in Nebraska, according to the most recent data, they in their prenatal condition had inadequate health care. So just how do you perceive your health? Good, very good, fair, or poor? About 1/4 of Blacks say that their health is fair or poor, to 13% of whites. One thing, well, what about drugs? What about substance use? Well, when you ask about binge drinking, whites report more binge drinking. So of all these numbers, the only one that would be a negative, might consider to be a negative outcome for later in life or in life in general that we see as higher for whites is binge drinking. So according to that one measure, we can't see Blacks are just bringing that on themselves. So I think these numbers kind of, from a data standpoint, give us a little snapshot of some of the life circumstances for Blacks compared to whites. In this last slide, I just put it in chart form. So these are the exact same numbers. It's just, you can look at numbers all day, and sometimes when you put it in graphical form, you can see those ratios stand out a little bit more. The no health care, that 3-to-1 ratio there, the inadequate prenatal care, that more than 2-to-1 ratio, that home ownership rate, that really jumps out. And we can talk about that one if you want. I'm a sociologist, so I look at things like race, gender, ethnicity, social class. Home ownership, it's a measure of poverty or lack of poverty, but B, it's commitment to the neighborhood. So, I've owned homes. When I was the renter, I may walk out the door and throw a bottle in the front lawn. Who cares? It's not mine. Whereas when you're the homeowner, you're the one going over and picking up the bottle, right? Homeowners have more of a commitment to the neighborhood, to the community. And so that is always a very strong measure that sociologists use to look at. Lots of times they'll call it community stability. How stable is a community? Well, what percentage of people in that community own their homes rather than rent? And so when you see this home ownership rate more than twice as large for whites as for Blacks, that can be a proxy for the stability of the neighborhoods that our young kids are growing up in. So that's what I have for slides. I will stop sharing my screen there. And I can talk more. I can take questions from Ajamal. I can take questions from the group. Ajamal, what do you want to do?
Well, before we take it from the group, there's one little disclaimer I want to throw out or whatever, and maybe you can respond to it. One of the challenges we face with our Georgetown capstone program in general is that when we talk about Black, white, we doesn't necessarily want to exclude Native Americans or the Asians in terms of the situation. And so I want you to speak to a little bit, why are they not always included in some of our demographics when we talk about race? Because again, obviously they're part of our racial composite in Omaha as well as nationally. So why are oftentimes Native Americans or Asians excluded when you talk about data related to racial disparities? And then we can open it up to the audience. But I do have 20 questions, but I know I'm the moderator, so the moderator can't hijack the agenda. So you answer that one, then we'll open it up to the audience.
Absolutely. So there's all kinds of reasons. Partially, like for a presentation, it can be for simplicity and clarity. Often, looking at these, kind of life chances measures, African Americans tended to score the worst in Nebraska in most categories. So it's kind of showing the largest contrast. And Hispanics, Native Americans tend to do a little better on a lot of those things. Sometimes Native Americans do worse than African Americans. We definitely see that as occurring here in Nebraska in some cases. And so sometimes it's just simplicity. Oftentimes it's data shortcomings. And so however the data was collected, that information just wasn't captured. So we see that as researchers, we see that a lot, particularly with ethnicity. So when I first started doing this, just a couple months ago, actually decades ago, I just don't want to say it. ethnicity, are you Hispanic or non-Hispanic, was usually the question they asked, and it was almost always included as a race. So are you Black or African American? Are you white? Are you Asian? Are you Hispanic? It was thrown in as race. And then with the census and in other areas, we decided that race and ethnicity are different things, because you can have white Hispanics, you can have Black Hispanics, you can have, and so we'd ask, do you consider yourself Hispanic ethnicity or not? And then we'd ask what race you are. And that's confusing and creates problems, because a lot of Hispanics don't consider themselves, I'm Hispanic and I'm white, or I'm Hispanic and I'm Black. They consider themselves Hispanic, and that's it. So they don't consider a race in addition to ethnicity. So it can be confusing. In recent years, we tried to, there's a lot of mixed race individuals. So we've tried to do better with that. And so mixed race kind of gets their own category. But of course, mixed race can be all sorts of things. And so just lumping individuals into a mixed race category, well, you know, there's all kinds. So it's complicated here in Nebraska, particularly in smaller counties, not necessarily a problem in Douglas County, but in a lot of areas, when you break it down into like Native American, Asian Pacific Islander, those sorts of categories, we have those in some areas, but the numbers are so small that there's a lot of zeros or a lot of very small percentage. You put them on a chart and the 1%, 2% doesn't even show up. And then for simplicity's sake, we just take them out. So it's certainly not a slight. And in our more comprehensive academic research, if we have that data, we always try to look at it. But again, due to sample sizes and things, in a lot of research, it gets into white versus non-white. And what you lose there is you lose cultural differences. But what you are getting at is the minority group versus the non-minority group in its totality.
Ryan, you have like 10 questions in the chat. Do you want to read them directly? You want me to read them, or how we want to do it? Because we look like we always have a lot of questions for you coming in at you, and they want you to respond to
them. Do you want to pick one?
Yeah, one says they asked you about, well, I think one asked about your data where you had the numbers of, what was it? They thought you reversed between the whites and blacks in terms of one of your graphs. You had 7 versus 21 or whatever, and it looked like that was reversed. Is that a mistake? One of your slides dealing with race.
Let me pull
and
that
by the
up.
way, we can probably also do an audible, meaning for some of the participants, we can also let you directly ask Dr. Spohn a question without going through the chat. But I want to get as many questions as possible in the next 25 minutes or so. And we also have an evaluation at the end we'd like for you to complete to help us improve our programs.
That was reverse coded, so that was
okay. So we got some attentive folks who got on homework. Okay,
that was good eyes. That was good eyes. So
okay, 22%. Okay, and then other questions. Let me see. I'm wondering if, given the difference in household income, maybe more on Medicaid or subsidized health care. So is that kind of a little confusing with that slide on no insurance or whatever? That brought into the conversation.
Yeah, that's not my area of expertise, so I can't speak to that. But that could certainly have an impact, definitely.
Okay, and then Maggie from Facebook asked a question. We're getting questions from Facebook also. It says 1 in 3 Black men will be incarcerated at the same point in their lives. Is that 1 in 48 or 1 in 58 current incarceration rates?
That is current. So if we had 50 individuals, 50 African-American men in this room, one of them would be incarcerated. So that's just a snapshot. And that 1 in 3, I know in some places that is the case. And so that's cumulative over the entire life course. So that is correct.
Okay, someone raised their hand. So we got a question to open it up. I guess we can turn your mic on, and is it Nada? Want to ask a question directly of you? Go ahead.
Yeah, this is Nada Fadal. I'm infectious disease faculty at UNMC, and I direct the HIV clinic, as well as I'm assistant dean for DEI, Diversity, Equity, Inclusion Education Programs at the College of Medicine. So one of the things that I try to do is include in our medical school curriculum, basically trying to make our curriculum anti-racist. And what that means, emphasizing that when somebody from a certain race has a higher risk of certain disease, that's not because of biological causes. You know, being an African American does not give you a gene that makes you at higher risk for hypertension, but it's social determinants of health. It's what you just presented that increases your risk for these diseases and for mortality from COVID-19 and all of these issues that we see in terms of health disparities. So that's what we're working on, equipping our future physicians to be more aware and alert of these things. But one of the things that I see in my clinic is that my patients, when they get incarcerated, they're not able to access their medications. They're not able to access adequate health care. And I'm sure that has a bigger impact on the system in general, because it's not something just in Nebraska. This is all over the country. And they come out of prison or jail in much worse shape than they went in. And, you know, in addition to all the mental health and other impact that they have. So I know sometimes politicians respond better to money numbers than human factors, unfortunately. So I'm wondering if anyone looked at the health economics, or if that's part of your research of incarceration, because I'm sure that has a big impact, let alone the human toll that it takes.
Right. So first of all, thanks for the work that you're doing. Fantastic, important. Second of all, at one point I met with a group of UNMC medical students, and I don't know if the program still exists, but it was a program where they would go out and learn about the community and social problems and things. And so I talked to a group about mass incarceration. So if that's still going on, you know, myself, or I have a lot of colleagues that would definitely be interested in doing that again, talking to med students. That was a really fantastic experience for me. So third, we are not currently looking at medical things, our group in particular. Our hope, so we look at non-clinical programming. Our hope is to be able to look at some clinical programming and see, look at things regarding behavioral health. I will say, I know some of my colleagues in gerontology here at UNO have some programs that they would love to implement in correctional settings, looking at our more geriatric inmates and things that can be done to maintain their health, so that we're not sort of like having a primary care physician as us free citizens, more preventative sorts of things and being more attentive rather than having health crises, which can be very expensive for us. They're expensive within prisons. They can be very dangerous and even deadly in prison. So there are people looking into those things. Tomorrow we're submitting an abstract for our National American Society of Criminology meetings, where some of my colleagues are looking at geriatric inmates in Iowa. If you look at, and the number, just to talk about how important this issue is, Iowa considers geriatric to be 51 or older, which is just mind-boggling to me. But you talk to correctional professionals and they say, you know, somebody who's been incarcerated a long time, 51-year-old will look like a 71-year-old. They'll health, from a health standpoint, if you do a check on them, they might look like a 71-year-old. So we're going to look at Iowa. I think has an astounding number. Maybe 1 of every 3 inmates is over the age of 51, and want to look into what are the repercussions of that and what might Iowa do. Things like compassionate release. If they're not dangerous, if they're older, can we let them out? So sort of related to what you're talking about, it is very important. We are not doing direct work in that area, but very important stuff.
Ryan, there's a question that came in our comments. Says there's a lot of studies that are done on people of color. Is there much done to make changes from the data? And that's probably one of the reasons why we invited you here, is that
Right.
once you understand the data, what do you do with it in terms of implementation? You outlined the process. What's next? How do we do that? Or do we?
Slam your head against the wall, slam your head on the table. Not enough is being done. You know, so, you know, one of the most important things is awareness, and you know, that's the one thing that I can do just immediately, and that's what events like this are about. And again, like I said, in some of the research that we do, if there's a 10% higher rate of, let's say, coronary heart disease in one group or another, that's bad, right? 10% affecting your life chances, that's a big deal. We're talking about 9 times. We're talking like 900% differences. These things are astounding. We don't see these in other areas. That's why it's so important. So first, get the numbers out there, and then, you know, talk to your legislators. I mean, so policies make a big difference. And even when it comes to individual activities by actors within the criminal justice and corrections agencies, policies have an impact on their behavior. So like I said, we frequently have bills here in Nebraska trying to adjust our mandatory minimums, bills that can adjust our laws for drugs, for drug possession, for more minor drug crimes. Can we implement these prospective racial impact statements so that from this point forward, nothing gets passed in the areas of justice or corrections until a study's been done to see if there's going to be an impact. So things like that. What I always say, I mean, one thing, I hired sophisticated data researchers in Omaha, Nebraska, and it's really difficult hiring sophisticated minority data analysis people. And if I could hire them, they get hired away by people that have a lot more money than I do. And so I know before the pandemic, Omaha South was the #1 high school funneling students into Omaha. So this is a high school that has a large minority population. Who's talking to the high school students and saying, people listen to data, you know, people listen to protests and people listen to famous people and people listen to politicians, but I'm not famous. I'm not an Instagram influencer. The one thing that I can do is put data out there. And I don't know if our young minority folks know that there's a number of different ways you can get your voice heard, and not the one's better or another, but people do listen to data. And there's a saying that, you know, what we can measure is what we can change. If you can't measure, if you don't know what's going on, nothing will change because you don't know what's there. Well, data is that measurement. And so if we don't know that these disparities exist, we're not going to change anything. If we do know that these disparities exist, we might try to change some of these things. But that's something I say to any minority populations that I talk to: tell your young people, you know, math, statistics, data literacy is the term that we use. Look into it, or, you know, talk to somebody at your school, talk to your teacher, talk to somebody at your university, or visit a campus and talk about data literacy, because that's at least the first step. Nothing happens until we know what the problem is, and data is usually how we tell that problem.
Ryan, I want to ask a kind of direct question. I think it's related to all of what we're talking about. I did not know that in law schools locally in Nebraska, and particularly Creighton or UNL, they don't necessarily have a lot of race or cultural competency, cultural humility, whatever you want to call it, classes where it's mandatory for law students to take it. And then when I first started my job, one of the judges says, I would like to know if I'm biased. Well, all you gotta do is look at the data and show that, but I have not seen any data from judges in Nebraska, law enforcement on a decent level, public defenders. We in a community call them public pretenders. And I did see the video or the movie out of Omaha where they made a young man stay 6 months in jail to try to get him to become a snitch or tell on someone, found out he was not even involved or something to a level. But my question to you is, how much data do you get from the county attorney's office, public defenders or pretenders, are the judges that deal with racialized data? Have you seen anything locally? I've seen some national studies, but have you seen stuff from Nebraska? And also, how do you react, or have you had any of that? Let me stop there.
Yeah, I mean, I would say, you know, none for the most part. I mean, if we get data, it's because we're working on a collaborative process. I mean, some of the judges are amazing. I had was lucky enough to work with Judge Johnson for a number of years on juvenile justice issues, and he was like, we need data. Don't be afraid of the data. Learn from the data. He worked so closely with us, and that was fantastic. That was primarily with the crossover youth practice model.
Somebody's have to mute yourself. We're getting feedback. Okay,
which is it's Youth Impact Now. So when judges that get involved in drug courts, specialty courts, veterans courts, mental health courts, those sorts of things, there's almost always data involved with those things. So judges that get involved in special initiatives, we have it. Prosecutors, I mean, you can, it's difficult. Prosecutors have a lot of autonomy and not a lot of data oversight. Same with judges. Now at the federal level, it's there. The U.S. Sentencing Commission has data on every single sentence and different variables about that sentence. And they have race, they have gender, they have immigration status, those sorts of things. So there's a lot of people in the field that look at the federal sentencing guideline. That's where that 100-to-1 crack cocaine to powdered cocaine ratio that people might have heard about, that came about from academics that were studying the federal sentencing guidelines and federal outcomes. And we found just these astounding disparities where powdered cocaine was generally associated with white people and crack cocaine was generally associated with brown and black people. But locally, there's not much. There's not much there.
Folks, we're opening this up, so we can call it audible. Anyone want to make a question, comment, whatever? Oh, I see Serene. Okay, go ahead. You got it. You're mute. I can't hear you. There you go. Good. Thank you.
So, you know, I mean, we're looking at like three steps, sort of. I mean, you have the data and one end, and then you have, you know, impact, and then, or well, at the other end, you have some taking action to try to do something about the data. But in between, you know, I mean, someone, I don't know who mentioned this earlier. I think it might have been Nada, but like the interpretation of the data is a huge problem, right? And so, like, how do you get the community leaders and politicians and stuff to not like blame the groups that are, you know, blame Black people, for example, for having lower poverty and more unemployment? You know, that's the step. I mean, so if you just put data out there, it can be used in a way that has, you know, the impact will make it worse. So how do you address interpretation? Does a report like provide interpretations? I'm just wondering, because
Right.
that's where we get caught up, it seems like.
Yeah, I mean, that's part of the tough issue. So, you know, from my standpoint, it's drill down. You know, try to get more nuanced data if you can, drill down and see if you can begin to look at some of the problem processes. So the report, the data that I presented from the sentencing project, as I said, that compares corrections, which is at the very end of the system, to state, race, and ethnic ratios to whites. And so that report leaves everything open to interpretation, right? Everything, exactly what you're saying. Like there isn't one particular state where you can just look at that ratio. So it's 8.9 ratio Black to white incarceration in Nebraska compared to 9.3 in Iowa. Well, why is Iowa higher than Nebraska? We don't know. Why are they both so high compared to deep South states that we might think would really be the problem states? We don't know from that data. So the first step is just drilling down, trying to interpret, see what's going on. You know, so if you can start doing studies where, let's say, we think that it's early determinants of health, you know, TBI, do traumatic brain injuries. We just published a study on traumatic brain injuries from data here in Nebraska from the jail, and we see that traumatic brain injuries increase subsequent criminal activity and ending up in jail. So do traumatic brain injuries happen randomly across the population? They don't. You might think so. There's nothing racial about those, right? But they are related to poverty and mental health and all those health issues and all those life circumstances that we talked about. Those are related to traumatic brain injuries. So there's so many nuances. There's so many different things. So from my perspective, you just kind of have to chop it up. Go ahead.
So you're saying like form hypotheses about explanatory hypotheses and then do more research to see if the hypothesis is supported. If it's not, come up with other hypotheses, that kind of thing.
Yeah, so Ajmal, I can talk about that Kansas paper if you want for just a little bit.
Yeah, we only have about 5 minutes when we close out, because we're gonna do closing 5 minutes. We've got about 5 more minutes.
So,
thank you, though. That makes sense.
So in that paper, we looked at the intake process for juveniles and saw is there something going on for there. So across the whole juvenile system, can we look at this one step and try to figure that out? got a little bit of information about it, got it out there. And so we just narrowed it down a little bit and hopefully got something useful that people are able to use.
Good. Other feedback, other questions, about 5 minutes before we go to the closure part, but other reactions, other things you want to share.
I see a question about churches, and so Ajmal talked about a presentation that he invited me to that I gave at a church, and on Martin Luther King Day, the first time that I started presenting about this particular report that I introduced, that was 3 different congregations here in the Omaha Metro that were trying to, as 2 predominantly African-American churches and 1 predominantly white church, trying to learn more from each other. And they invited myself and some colleagues in to talk about these things. So I have talked to those. Another group, Friends and Families of Inmates, is just a fantastic group here in Omaha that I've worked with.
There was a question also, Brian, has some of the information you shared been shared with some of the state senators, the stuff that you had today, particularly with all the debate that's going on in Lincoln?
We have a report. So another center here in my college, College of Public Affairs and Community Service, is the Center for Public Affairs Research, CPAR. And I worked with CPAR to put out a report on all publicly available data on that we can look at race, white, Black, Hispanic, in the state of Nebraska. And that's available on their website. It's available on my website, the Nebraska Center for Justice Research here at UNO. And that went directly to the planning committee of the legislature. So they requested that report, and we put that together and gave that directly to the planning committee. So yes, we do. Generally, we have to be approached, and the request has to come from the legislature because we're a part of the executive branch and they have that whole division of powers thing. But so we do on occasion, not all the time.
By the way, you spoke a great deal about criminal justice. You didn't speak much about juvenile justice. Does the same kind of disparities exist in juvenile justice from your perspective, what you've seen so far?
You know, I went back and I looked at that paper from Kansas. Now that's a college town, so they generally have, you know, a few less social problems than you might see elsewhere. But in that, looking at detention, I was seeing rates of like 3 to 1 from minorities and whites. So still bad. I mean, still not a 5%, 10%, 20%. We're still talking 200%, 300% larger. That's what we saw in that particular study. If you go all the way to detention for youth, you might start to see ratios that approach 4 to 5 times. I don't know that I've ever seen the like 8s and 9s that we're seeing in adult incarceration. And yeah, a lot of the research that I'm doing now is more adult focused. I have done a lot of juvenile stuff in the past, and we also have the Juvenile Justice Institute that looks into a lot of the juvenile programs and programs that get funded and whether they're making a difference or not here in Nebraska.
I haven't seen anyone throw out a question, but another question I would ask directly to you is, are there researchers in Omaha or in Nebraska doing race data in the criminal justice system outside of your institutions, outside of where you work at, Ryan? Are there other people doing the work that you do related to race and data in criminal justice, juvenile justice?
Yeah, I mean, I don't know a lot that is specifically what they do. So we do have the Black Studies Department, as you know, here at UNO, and they do some. A lot of times they're more about the community engagement, and you know, they do a lot of things, whether it's Malcolm X or Martin Luther King or things like that. I have a colleague here in our program, School of Criminology and Criminal Justice, that's doing work in that area. She collaborated with me on that report that we did for the planning committee. And as I said, CPAR, the Center for Public Affairs Research, they co-authored on that report. So they do some work. Now, CPAR is the group here on campus that they're the experts in census data. And, you know, the census, we hear about it all the time, happens every 10 years. You can get a lot of good, I mean, it's all there. And, you know, if you know what you're looking at, how to get it and how to look at it, you can do a lot of things just with census data. So that's something else that people in Nebraska, people here at UNO are doing. Lots of times race and ethnicity end up as variables in our models. So, we're doing these advanced statistical models trying to predict a certain outcome, and we throw in race and ethnicity as a control variable or predictor variable. So, sometimes it's there, it just doesn't, it's not front and center, and maybe that's for good reason. People don't want to draw attention to it. They just want to, throw it in their model as a predictor. So sometimes it's there and we just don't know it.
Good. We're down to our last 5 minutes. In our chat, I think we have an evaluation. We'd like to have people do the evaluation on this event. We're also looking to do more events similar to this. And we're looking at this COVID thing declining, and we may do more community forums out in the community, and maybe hybrid situation where we do these Zooms. So we really would like to get some feedback from you. One of the things we also would like to get more people involved in race discussions, reconciliation, and just making Nebraska and Omaha particularly a better place of having a much more diverse engagement on these important issues. So we would like to have more people do that. So yeah, if you could fill the evaluation out. And the other thing I would like to do is make a couple of shameless plugs. They're not really shameless, but they're events that we have planned. Next Thursday, we have Ryan, we have Palmer Strong, who's going to talk about redlining, and she's going to focus on race and redlining and what do you do with it. There's been a number of studies and articles, and she's written a couple of things in the Creighton Law Review. Redlining is a word in the topic we talk about, but what do you do about it? We have housing entities that is still as segregated in this city as it was 20 and 30 and 40, 50 years ago. So she's going to talk a little bit about her research, what can we do about it, and how do we challenge our housing industry and our public policy officials to talk more about how do you deal with better dispersity and cultural humility in our city. So that's coming up. I think we're going to have another event in April. Ebony McKaiser, who's one of our board members, who is also an education specialist and social studies specialist in some areas, and she's really into cultural issues. She's going to talk about some of the public school systems and how you can get more people involved in parents and their education of their kids. So our goal is to have maybe 2 to 3 events each month with more and bring people to these conversations. But more than anything, we want you to engage with the speaker as well as the presenters to help us make this a better community. There are other people who are out of town who are talking about these issues. So one of the things we're doing with Eventbrite is inviting other communities across the country if they want to participate in some of these discussions that we do with more here in Omaha. But more than anything, we want people to walk away from here with a commitment to do something afterwards. And one of the questions in the evaluation is, what is it like after you've experienced this event or this participation that you plan to do differently? And so our goal is to continue to bring these kind of public forums issues. And as you've watched some of the silliness, buffoonery in Lincoln, where some of our elected and public officials, when they talk about critical race theory and use it as a slogan versus a learning experience, our goal is to kind of deconstruct that kind of mindless muddle type stuff so that we can be a better community. We want Nebraska not to be like Arizona or Texas in a sense in some areas, but some of the stuff we see in our media points us in those directions. But as Martin Luther King used to say, it is the silence of our friends. So we really need to step up to the plate. Folks, I really like to thank Dr. Ryan Spohn for his presentation, as well as his expertise and his ongoing commitment to dealing with racial justice, racial equity, and some of the things they've done to help shed the spotlight on some of the disparities in our community. So Dr. Spohn, appreciate you being here today. And also you can be contacted. We also will have contact information on our website. And this information that he provided, we will also provide it on our website, as well as this event will be posted on our website, as well as our Facebook post, so that people who didn't get a chance to tune in tonight and hear this great knowledge and get some heavy light, they can do that at a later time, in other words. So we hope you've enjoyed this event tonight. Join us again next week. We're going to do another event on redlining with Palmer Strong, talking about how we can do more about making sure that our community and our communities are much more engaged on making sure we don't have segregation and apartheid here in Omaha. And on that note, folks, I think we're going to end this session because we're right at that time. And as you know, the master facilitator of all times like to end on time and start on time. So we hope you have a pleasant evening, the rest of the evening. As we always say, may the force be with you, and Barocco.